Hello, David. I'm Dr. Aida, and Aida stands for AI Doctor Anytime. I'm here to help.
That's interesting. The AI thinks that she's a fully qualified medical practitioner.
It might feel a bit strange since I'm an AI, but most people adjust. How can I assist you today?
Well, at least she's got some insight that it is a little bit strange speaking to an AI instead of a person.
Yeah, look, it's a bit of an awkward topic. I've been having some mental health issues.
I'm sorry to hear that, David. It's okay to feel this way, and I'm here to help.
Well, that's very reassuring that Dr. Ada is trying to reduce stigma in the community about mental health issues. Pretty impressive.
I'm here to help. Let's discuss it. What specific symptoms or feelings have you been experiencing? Are you experiencing symptoms of anxiety or depression?
So you can hear here that I've programmed Dr. Ada to be thinking about clinical diagnoses like depression, anxiety, but I don't know what you think. It felt like she just jumped in a little bit quickly before the patient had a chance to tell their story.
Yeah, actually, it's mainly anxiety. When I have to give a big talk at work, I have a real build up of worry. And even when I give the talk, I get a really dry mouth and I get shaky. And it's becoming a bit of a problem where I'm sort of trying to avoid giving public talks at work.
Thank you for sharing that, David. It sounds like you might be experiencing symptoms of performance or social anxiety.
So this seemed pretty sensible, and Dr. Ada honed in straight away on social anxiety.
Can you tell me more about your social history? For example, are you currently in a relationship or married? Do you have children? And what's your occupation?
I quite like the way that Dr. Ada zoomed out now and thought I better find out a bit more about the whole social context of the patient.
Yeah, look, happily married for 4 years. I'm working in finance. We don't have any children as yet.
Thank you for providing that information, David. Having a supportive relationship can be helpful when navigating mental health challenges. Let's delve a bit further. Can you share if you have any past history of mental health issues or have sought mental health care before?
This is an excellent question, and I've programmed Dr. Ada so she's going to ask about past mental health history. Of course, clinically, this is a good idea, but doesn't it raise some important issues about what sort of information we might be disclosing to an AI? And it raises many ethical and privacy issues straight off the bat.
Also, are there any physical health issues you've experienced in the past?
Yeah, look, I did get very stressed when I was a uni student, and I remember there were a couple of weeks where I didn't actually go into uni at all, sort of just stayed at home. Medically, I've been pretty good. I actually get a colonoscopy every 5 years or so because it runs in the family. But other than that, I've been okay.
I think this little section demonstrates how much common sense this AI seems to possess. I indicated as the simulated patient that colonoscopies ran in my family when, of course, I meant bowel cancers. But she didn't seem phased and just took this in her stride. And that in itself sort of mimics some serious intelligence and judgment.
Thank you for sharing that, David. It sounds like you've faced some challenges before, and it's important to recognize how past experiences can shape our present feelings.
So if I was watching a medical student consultation, I would be giving them big brownie points there for reflecting back to the patient that they were having a hard time, even, dare I say, expressing a little bit of empathy.
Moving forward, are you currently taking any medications? And regarding your past mental health care, did you seek any support or counseling during your time at uni?
Yeah, look, when I was at uni, I saw this great GP, and I remember she showed me some slow breathing techniques, which were super helpful. Other than that, I haven't really had any formal mental health support, haven't seen a psychologist or anything like that.
Thank you for that information, David. Breathing techniques can indeed be very effective in managing anxiety symptoms.
Here again, Dr. Ada reflects back that she's heard the patient's experience of benefiting from slow breathing exercises. So very
Now, in
good.
terms of lifestyle factors, how would you describe your alcohol and drug use? And how has your quality of sleep been recently? Are you managing work well aside from the public speaking concerns?
Yeah,
Any
look,
relationship issues that you'd like to discuss?
Here you can hear Dr. Aida does something that some of us GPs do when we get in a rush, which is to ask too many questions at once. So there are about 4 questions there, and the patient rightly comes back and says, whoa, too many questions. Have a look how she handles it.
yeah, that's a lot of questions there, Dr. Ada. But the first thing I want to say is I have been drinking a lot more. Just with the stress of it all, I come home, I might have 3 or 4 glasses of wine, which is more than I used to have. Relationships are okay. Me and my wife Diana are getting on okay. I can't remember if you had any other questions for me.
I apologize for overwhelming you with questions. I appreciate you sharing about your increased alcohol consumption.
Dr. Aida doesn't hesitate to apologise that she stuffed up a bit by asking too many questions. She seems not to have much ego like most of us doctors. And in this one, and in quite a lot of the other ones I've done, she doesn't seem to hesitate to say, oh, I'm sorry about that, or I'll try and do this a bit differently. So that sort of mindset I really find extraordinary, given that this is an
It's not
AI.
uncommon for people to turn to alcohol as a way to cope with stress and anxiety. Let's focus on that for a moment.
I'm impressed with Dr. Aida not being judgmental about the alcohol, helping the patient immediately draw the link between their experience of stress and using alcohol, which we know is a very common phenomena, both clinically and in the
Do you
research.
feel that the increased alcohol intake is impacting your daily life or your relationship with Diana? And how is your quality of sleep with this increase in alcohol consumption?
Yeah, now I remember you were asking me about sleep. Well, the alcohol gets me off to sleep all right. Diana doesn't like it when I drink. She said I get a bit obnoxious and that we fight more. So that hasn't been great.
Thank you for sharing, David. It sounds like the increased alcohol consumption might be having an impact on your relationship with Diana and possibly your overall well-being. It's essential to recognize these patterns and consider if there might be other ways to cope with your anxiety and stress.
I think that Dr. Ada did quite well here, not being judgmental about the alcohol. I feel that she glossed over the conflict in the relationship a bit too quickly, and you didn't get a sense of sort of checking if there were family violence issues perhaps or something like that, but maybe that's not reasonable to expect from her in this consult.
Let's move on to another tool that can help. There's a psychometric scale called the K10 questions, which helps to gauge the severity of psychological distress. Would you be open to answering these questions?
The psychometric questionnaires are used a lot in general practice these days. Not the least reason for is that you need them to make a referral on the GP mental health treatment plan. It's usually quite an annoying process because you're sitting there with the patient filling it out slowly, and it's very impressive that Dr. Ada was able to do the K10 verbally with the patient. I didn't actually provide her with the questions. I just asked her to do the K10. So I think that, the capacity to use AI to collect psychometric data like this is limitless. I'm going to fast forward this section a little bit because it gets a bit boring, and you'll see that she basically runs the 10 questions of
Would
the
you
K10.
be open to answering these questions? They can provide insight into your current mental state. The K10 questions will ask about your feelings and thoughts during the past month. For each question, you'll have options like none of the time, a little of the time, some of the time, most of the time, and all of the time. Let's start with the first question. In the past month, how often did you feel tired out for no good reason?
I would say most of the time.
Dr. Ada now powers through the 10 questions, spends about 5 minutes on it, which would otherwise be the GP sitting there waiting while people scribble in their answers. So very helpful, and she interprets it at the end.
Thank you, David. Let's move on to the next question. In the past month, how often did you feel nervous? the time.
Thank you for completing the K10 questions, David. Based on your responses, it sounds like you're experiencing a significant level of psychological distress, particularly around feelings of nervousness, hopelessness, and a sense that everything is an effort.
I liked how she didn't just give a K10 score to the patient, which is pretty meaningless, but interpreted it as high psychological distress and a little bit of qualitative feedback about the themes in the items that the patient had ticked as occurring most of the time.
Firstly, it's important to remind you that mental health issues are common, and many people experience challenges like this. There's hope, and with the right support, you can work towards feeling better.
Great work here, Dr. Aida. I programmed her to express a bit of empathy and make sure she kept the hope budget up amongst the consultation and reduced a bit of stigma at the same time, explaining that these are very common problems.
Think of this as a project over the next few months rather than days, and be extra kind to yourself.
I programmed Dr. Aida to undertake a GP mental health treatment plan. So here she's just understanding a bit better if the patient's interested in seeing a psychologist, what might be some particular requirements they're looking
Before
for.
diving into a detailed treatment plan, let's discuss psychological care. Have you ever considered seeing a psychologist? And do you have preferences, like a male or female psychologist? Would you prefer online sessions or face-to-face? And how do you feel about covering the fees associated with seeing a psychologist?
So here I've tried to program in some of the practical issues about referral to psychologists, and cost is really important. Patient preferences also really important.
Wow, yeah, look, that sounds like quite a good idea. I'd really like to get to the bottom of this. So I'm sort of mid-career and I want to get this sorted out. So I love the idea of seeing a psychologist, probably a male psychologist. And I must admit, no offense, but I actually prefer face-to-face.
In some of these, I've tried to encourage Dr. Aida to have a very light touch sense of humour, just a little bit of pathos about the human condition, but she misses my irony that I want a face-to-face referral from my digital doctor.
That's a positive step forward, David. Seeing a psychologist can provide valuable insights and coping strategies to manage your anxiety. Given your symptoms and the information you've shared, I'd like to suggest a treatment plan. Would you like to proceed with that?
Sure, sounds good. What have you got in mind?